I want to also talk a little bit about implied consent versus true informed consent. Joining us now, attorney Eric Salusta. Eric, you work with a lot of patients. Can we talk a little bit about informed consent versus explicit or implicit consent?
Right. Well, when we talk about informed consent, we're talking about a general consent form that describes the procedure that's going to be performed as well as the risks and benefits of the procedure. And when you talk about explicit consent, it may delve into more specific areas, and it may place limits on what can and cannot be done during the procedure.
And I do want to let people know that we did an extensive search online. Most teaching hospitals have a vague line similar to this. I understand that this is a teaching hospital and that medical students may help care for me. And I think it's important to acknowledge that at teaching hospitals, learning is a huge part of it, and someday your life might be saved by a doctor who at one point in their career didn't know a whole lot. So that's where things get unique. But let's talk a little bit about how informed consent might be used in a scenario like this. Back to a patient under anesthesia who is having an invasive pelvic exam performed. Are there informed consent processes out there? I'm not familiar with them for something of this nature.
I have never seen an informed consent form that specifically allows for a medical student to perform a non-consensual, educational purposes only pelvic exam. I've just never seen that in my practice.
You've never necessarily seen that on the form, but I think in the Me Too era where 1 in 3 women are survivors of sexual assault, I think the explicit consent has to be there.
You know, as an OBGYN, I think we have 2 major issues here. Issue number 1 is just making sure women feel respected and making sure that we enforce the fact that a woman has a right to say what is and what is not going to be done to her body, period. And, you know, that's just, I mean, that's the bottom line. And I think that's where the consent comes in. If the general consent isn't detailed enough to let her know that that's going to happen, then I think we should change that. But the second issue is we have to educate medical students. I think we all can agree that in 20 years we want doctors who are well trained. But my thought is if we can figure out a way to make people walk on the moon, like we can figure out another way to train medical students. And it goes back to number 1, if you ask a lot of patients, a lot of them actually will say yes. When we go into rooms with medical students, we'll say, oh, I have a medical student. Do you mind if she checks your cervix, if it's a labor patient? Or if it's in the clinic, we'll say, do you mind if she does a pelvic exam or if he does a pelvic exam? And most patients will be like, yeah, they gotta learn. And at that point, they're doing the exam and I'm saying, feel this, do you feel this? This is how it should be done. So there's open communication and the patient clearly knows that the student is learning and they're okay with that. But the point is they had an opportunity to say no if they didn't want it done. Other things, you can pay people. We also pay people to come in to do pelvic exams and learn to do pap smears. And also, I mean, lifelike mannequins. Maybe, I mean, we may have to change the way.
Or virtual reality.
Or virtual reality.
In this era,
we may have to change the way that we teach students, but they do have to be taught. But I can't say that I would say, okay, we got to teach students this way. If a woman says no, then it's no.
Well, and let's expand this conversation. I think this is important. We have to adopt new practices and acknowledge where we're at in current society. At the same time, a teaching hospital is very different than a non-teaching hospital. Number 1, I don't know that patients always know they're at a teaching hospital. It's not clear. So I think that gets back to not just formal informed consent, but just clarity and being more open with patients. That's such an important piece. And I've seen that evolve a lot since when I was in medical school. But one other important point here, and I'm speaking to really everyone watching, and that is this. If you do go to a teaching hospital, you're there for care, but you become a teacher if you're willing to. If someone comes in and says, hey, we have a medical student, and would you be willing to have them be a part of your team, and this is what we're going to do, and you accept that and say, yeah, of course, that medical student someday will hopefully save someone else's life.
Well, I think it goes back to transparency. And not only is it just women who have a right to say what's done to them. I mean, this happens to men too. They may be there for a colonoscopy and then students may go in and do a prostate or a rectal exam.
Which are tricky and hard to learn.
Yeah, and those are learned by feel, really,
Exactly.
honestly. And so I think it goes back to what you're saying, this trend towards transparency and explicit consent. That's so important. But there is something to be said about the unique nature of training physicians, which you alluded to. And if you
different than
don't learn
anything
it
else.
properly, as the population ages, you want your doctors to be so well trained, and you want them to understand that. So I would say you're right. I think patients who are watching this should view this as an opportunity. Ask those questions. Ask who's participating in your care. Make sure you know, and if you're comfortable with it, know that as you teach those students, it may come full circle, and later on they may save someone else's life because they know what they're doing and they've been adequately trained.
And when push comes to shove, it's your life, it's your body. You should always feel in control. If you're ever uncomfortable, you raise that red flag and you say, no, this is not okay with me. Phoebe, thank you so much for highlighting this, researching it. Eric, thank you as well for being here. We'll have more information on informed consent on our website.